Hello everyone, my name is Michael Ahuja. I'm a fourth-year medical student, and today we're going to be talking about autism, specifically investigating self-injurious behaviors. Autism is a severe developmental disorder of the brain that begins at birth or within the first 2.5 years of life. The cause for autism is highly controversial. It's a combination of environmental and genetic defects. Unfortunately, it affects over 400,000 people in the US and about 500,000 in the UK. Autism receives as little as 5% of the research funding as other less common disorders. It's very difficult to diagnose autism. The child may appear normal, but gradually starts showing behavioral problems, including impairments in social interaction and communication, learning difficulties, restricted interests, repetitive behavior, and the worst all, self-injurious behavior. Autism can range from high functioning to severe in nature. Unfortunately, it can be a lifelong developmental disability. Repetitive self-injury to the same area is common, such as scratching in the same spot 100 times a day. The behavior is usually done secretly. It can be planned or impulsive without any thought. Prenatal testing can be used for not only early detection, but clinical treatment can be started in order to prevent the later stages of self-injury. There are many possible reasons why autistic individuals may engage in self-injurious behavior, ranging from biochemical to social environment. Two more commonly accepted theories are lack of pain perception and that self-injurious behaviors release beta endorphins, which in turn provides the person with a form of internal pleasure. So far, there have been two main drugs that have been given to these kind of patients to help reduce these behaviors: naltrexone, a beta endorphin inhibitor, and antipsychotics like clozapine and risperidone. Research by British scientists have found that prenatal testing for autism is possible. However, it has created an ethical debate. Prenatal testing would involve amniocentesis, whereby amniotic fluid from the womb is obtained and studied. The major ethical issue questions the need for prenatal screening, since autism is a life-limiting condition. The Autism Research Center of Cambridge University conducted a recent study that has correlated high levels of testosterone and amniotic fluid with childhood autistic traits, such as self-injury. The research team followed 235 children from birth to the age of 8, and the prenatal test revealed that more than 20-fold variation in these women with testosterone levels and amniotic fluid. The groundbreaking study has raised the possibility of an amniocentesis test to detect autism. The same procedure is used to test for Down syndrome. The National Autistic Society supports prenatal testing because they think a test to predict autism could be useful in helping parents prepare and get support for their child, as currently many children are not diagnosed until 2 to 3 years of age, which is a huge source of frustration. In addition, if further studies can indicate statistical significance, prenatal testosterone levels, and autism, then early treatment is possible. Testosterone blockers may be a source of treatment to prevent the adverse developmental behaviors and self-injurious effects of childhood autism. Now, while talking about autism, it's important to also differentiate the different groups in autism, like autistic disorder, Asperger's disorder, and childhood disintegrative disorder. Asperger's disorder is slightly different. It also has a greater incidence in boys like autism, but it's a problem in social interaction and behavior, but there is no language or intellectual deficits in Asperger's. The Asperger's child also is preoccupied with rules. In autism, it's more of a speech impairment. In fact, there's a lack of separation anxiety at early age. So in childhood disintegrative disorder, the child is actually functioning normal till the age of 2 and then starts functioning backwards as far as cognitive. They can also have repetitive and self-injurious behaviors. I believe there may always be conflicting views between pregnant women and healthcare authorities when dealing with womb testing for autism. Even if prenatal testing is found to be extremely beneficial for a child's development, ultimately the mother has the final decision. Autism is a unique topic, which is why it's raising so much debate, because it's more of a behavioral problem, aside from the 30% that may engage in self-injury. Although an autistic child might not function to full capacity, their health and physiological parameters are usually normal and can live a full life. Thus, it becomes difficult to force a mother to do prenatal womb testing for autism since it's not a fatal condition. I also think it's important that all pregnant women be educated about the pros and cons of prenatal testing for autism. Thus, when they make a decision, they have a clear understanding. The future for autism and controlling self-injurious behaviors looks bright. Hundreds of organizations and educational institutions have devoted to autism research and awareness. Thank you so much. That concludes this presentation.